Here at Fairview Mall, one of two grocery stores under construction to serve the residents of the Parkway Forest neighborhood. Now, this is an area that has grown with thousands of new people moving in without the grocery stores to keep up. However, in speaking with advocates, they say not enough is being done to address food insecurity.
It's a huge deal for this neighborhood.
Toronto Councillor Shelley Carroll enthusiastically reacting to recent announcements of two grocery stores opening up in the Don Mills and Shepherd area. The addition of stores at and near Don Mills subway station touted as key for convenience. Today, the community has around 20,000 residents, many of whom are apartment tenants, a far cry from 8,000 10 years ago.
This is a neighborhood that deals with hunger issues and access issues, and sometimes they're the same thing. It's not just a matter of whether you can afford the food, but can you get to it?
But advocates say grocery store accessibility is part of a larger problem that has yet to be fixed in a meaningful way.
Opening up a new supermarket doesn't change the income levels of folks who are struggling with access in that community.
Paul Taylor heads up Food Share Toronto and says a focus on store locations is a symptom of a larger problem.
Dealing with food insecurity is about dealing with housing, is about dealing with income, is about tackling racism. These are the key pieces. And if we don't, we're just going to see these issues get worse.
University of Toronto faculty that are part of a research team called Proof define food insecurity as having inadequate access to food due to financial constraints. They, along with Taylor and others, calling on governments to help boost wages versus one-off funding for food charities, such as increasing minimum wage to a living wage and guaranteed basic income. Nutritional sciences professor Valerie Tarasik says data shows roughly 1 in 7 Toronto residents face food insecurity and that people need to think of addressing it as a public health prevention measure.
Every time, we talk about the need for income-based responses and people say, well, we can't afford them. I just want to push back and say, we can't afford what we're doing right now. We're diminishing people's potential, but we're also wasting a lot of money, on healthcare budgets that are ballooning.
Meanwhile, back at City Hall, Carroll echoes the need for comprehensive action.
All of these things really need to be happening at the same time. We can't focus on one. We have to give energy to all.
For more on this story, visit citynews.ca. In Toronto for City News, I'm Nick Westoll.